the measles outbreak, how concerned should we be? We should be very concerned for a couple of reasons. One is that measles is a potentially dangerous virus. We know that individuals who get measles are prone to infections and respiratory problems, including swelling of the throat, pneumonias, bronchial pneumonias, and in other cases, brain swelling. The death rate due to measles is about 1 in 1,000. So this is a dangerous virus. Also, we have a large susceptible population in the United States. Vaccine rates have declined significantly over the last several years. And we know that measles is the most contagious virus that we know of. So once measles enters the community, like we're seeing now in West Texas, the virus can spread very, very rapidly. And we have an example of that. Now the virus is spread into New Mexico and Oklahoma. The best thing to do when there's a measles outbreak is to make sure that you've been vaccinated. We have 6 decades of experience with measles and the vaccine. We've had measles outbreaks in the United States, and the way that we've gotten them to stop is because we vaccinated at times tens of thousands of people to stop the outbreak. So really, that is the biggest, greatest tool that we have in our toolbox. 1 dose of measles vaccine, 93% effective. A second dose, 97% effective. And I can't think of anything else in medicine that is actually 97% effective. So that's really the way to stop measles. And even if you've been exposed, there's a sort of short window of opportunity where you still can get vaccinated and be protected. The therapies for measles are mostly supportive care. There's some data to suggest that vitamin A may reduce the likelihood of severe disease, but it doesn't eliminate the likelihood of severe disease due to measles. There's no evidence that cod liver oil or any other of these therapies that are being circulated now actually work. A lot of people are probably scratching their head thinking, did I ever get measles vaccine? I was born in the 1960s or 70s. Clearly, if you were born from the mid-60s on in the United States, and you got routine immunizations, for sure you got the measles vaccine. If you're not sure, or if you think that you may have been immunized with a killed vaccine rather than the live attenuated vaccine in the 1960s, and you're not quite sure, then the way to approach this is don't bother getting a blood test to see if you're immune. Just go ahead and get vaccinated. There's no downside to getting a measles vaccine, even if you've already had 1 dose. As this outbreak evolves, there are going to be many people who can actually define the point in time where they were exposed to somebody with measles. The measles vaccine is so effective that if you get the vaccine within 2 or 3 days of your exposure, the vaccine actually may prevent measles, assuming that you're not immune. Clearly, if you're immune, then there's really nothing to do. But if you're not immune and you're exposed, then you do have this window of opportunity to get vaccinated that will essentially prevent you from going on to getting full-blown measles, if you will. So there are opportunities not only before exposure, but there's a small window of opportunity after exposure. Now, of course, a lot of times the exposure is unknown. Before the characteristic rash develops, the individual who's got measles is contagious for 4 days prior to that. So a lot of times there may not be a clear exposure history. So to address all of this, just go ahead and get immunized, and then you don't have to worry about it.